The story of healthcare in Black America is tragically intertwined with a history of exploitation and abuse. One of the most horrific examples is the Tuskegee syphilis study. This study, conducted by the US Public Health Service from 1932 to 1972, deceived black men into believing they were receiving treatment for syphilis. In reality, they were left untreated, even after penicillin became the standard treatment to study the disease's progression. This egregious violation of human rights left a deep scar on the black community, fueling a distrust of the medical system that persists to this day. Segregation further compounded the problem. Jim Crow laws relegated black Americans to substandard healthcare facilities. These facilities were often understaffed, under-resourced, and offered inferior care compared to hospitals and clinics serving white Americans. This systematic denial of equal access to healthcare created a separate and unequal system that has had lasting consequences for the health of black Americans across generations. The legacy of this history is still felt today. Many black Americans harbor a deep-seated mistrust of the healthcare system, often stemming from personal or inherited experiences of discrimination and mistreatment. This mistrust can manifest as reluctance to seek preventive care, adhere to treatment plans, or even participate in medical research. It is crucial to acknowledge this painful past. We must understand how historical injustices continue to shape the health outcomes of black Americans today. Only by confronting this history can we begin to build a more equitable and just healthcare system for all.
The consequences of systemic racism are glaringly apparent in the stark health disparities that continue to plague black communities. Black Americans experience higher rates of chronic illnesses such as heart disease, stroke, diabetes, and certain types of cancer compared to their white counterparts. These disparities are not due to biological differences, but are rooted in deeply entrenched social, economic, and environmental factors. One of the most pressing issues is the disparity in access to quality healthcare. Black Americans are more likely to be uninsured or underinsured, limiting their access to essential medical services. This lack of insurance often leads to delayed diagnoses, inadequate treatment, and poorer health outcomes. Even when insured, black patients may face barriers to receiving the same level of care as their white counterparts. The COVID-19 pandemic starkly illustrated these healthcare inequities. Black Americans experience disproportionately higher rates of infection, hospitalization, and death from the virus. These disparities were directly linked to pre-existing health conditions, unequal access to healthcare, and the social and economic vulnerabilities that disproportionately impact black communities. These persistent health disparities are a stark reminder of the urgent need for systemic change. Addressing these inequalities requires a comprehensive approach that tackles the root causes of healthcare inequity. We must work to dismantle the systemic barriers that prevent Black Americans from achieving optimal health and well-being.
While the legacy of historical racism is undeniable, it is crucial to recognize the insidious role of implicit bias in perpetuating healthcare disparities. Implicit bias refers to unconscious attitudes or stereotypes that influence our understanding, actions, and decisions. In the healthcare setting, implicit bias can manifest in the way providers interact with patients, make diagnoses, and recommend treatment options. Studies have shown that Black patients are often perceived as exaggerating their pain, being less compliant with treatment, or being more likely to engage in drug-seeking behavior. These biases can lead to inadequate pain management, delayed diagnoses, and the prescription of less effective treatments. The impact of implicit bias is often subtle and unintentional, but its consequences can be profound, eroding trust and contributing to negative health outcomes for Black patients.
Beyond individual bias, we must also address the social determinants of health, which play a significant role in shaping health disparities. Social determinants encompass the conditions in which people are born, grow, live, work, and age. These factors include socioeconomic status, education, neighborhood, and access to healthy food, safe housing, and transportation. Black Americans are disproportionately affected by these social determinants due to systemic racism. They are more likely to live in poverty, experience food insecurity, reside in neighborhoods with higher crime rates and fewer healthcare resources, and face discrimination in education and employment. These factors contribute to chronic stress, limited access to healthy choices, and increased exposure to environmental hazards, all of which have detrimental effects on health. Addressing healthcare disparities requires acknowledging the pervasive influence of implicit bias and the profound impact of social determinants. We must work to dismantle these systemic barriers that prevent Black Americans from achieving optimal health and well-being.
Section 4. A system, unequal funding disparities and access to specialists. The systemic nature of healthcare disparities is further underscored by the stark funding inequities that plague healthcare institutions serving predominantly Black communities. Hospitals and clinics in these areas often operate with significantly fewer resources than their counterparts in predominantly white neighborhoods. This disparity in funding translates into fewer doctors and nurses, outdated equipment, limited access to specialty care, and a lower quality of care overall. The lack of access to specialists is particularly concerning. Black patients are less likely to be referred to specialists, even when medically necessary. This disparity in referrals can delay diagnoses, limit treatment options, and lead to poorer health outcomes. For example, Black women with breast cancer are more likely to be diagnosed at later stages and have lower survival rates compared to white women, partly due to disparities in access to timely and specialized care. These systemic barriers are compounded by the concentration of poverty and lack of health insurance in many Black communities. Hospitals serving these areas often struggle to stay afloat financially, as they care for a disproportionate number of uninsured or underinsured patients. This financial strain further limits their ability to attract and retain qualified healthcare providers, invest in new technologies, and provide the same level of care as hospitals in more affluent areas. Addressing these systemic funding disparities is crucial to ensuring equitable access to quality healthcare for all Americans. We must advocate for policies that prioritize funding for hospitals and clinics serving underserved communities, expand access to affordable health insurance, and incentivize healthcare providers to practice in medically underserved areas.
Section 5. Bridging the Gap. Diversity in healthcare and community outreach. Breaking down the walls of healthcare apartheid requires a multi-pronged approach. One crucial aspect is increasing diversity within the healthcare workforce. A more diverse healthcare workforce, reflecting the demographics of the patient population, can help to build trust, improve communication, and reduce cultural barriers to care. Black patients who feel understood and respected by their providers are more likely to engage in their care, adhere to treatment plans, and experience better health outcomes.
However, simply increasing diversity is not enough. We must also address the systemic issues within medical education and training that perpetuate implicit bias and contribute to disparities in healthcare delivery. Medical schools and residency programs must prioritize cultural competency training, teaching future healthcare providers to recognize and address their biases, and equip them with the skills to provide culturally sensitive care to diverse patient populations. Another essential component is investing in community outreach programs that address the social determinants of health. These programs can connect residents of underserved communities with resources such as healthy food options, affordable housing, job training, and transportation assistance. By addressing the social and economic factors that contribute to poor health outcomes, we can create healthier communities and reduce healthcare disparities at their root. Community health workers, trusted members of the community who are trained to provide health education and connect residents with resources, can play a vital role in these outreach efforts. They can bridge the gap between the healthcare system and underserved communities, building trust and facilitating access to essential services.
Section 6. A call to action, dismantling healthcare apartheid. The fight for health equity is a fight for social justice. It is a fight that requires the collective action of individuals, communities, and institutions. We must all do our part to dismantle the systems of oppression that perpetuate healthcare disparities and create a more just and equitable society for all. Educate yourself about the history of medical racism and the ongoing healthcare disparities faced by Black Americans. Share this information with your networks, engage in conversations about race and healthcare, and challenge racist attitudes and behaviors wherever you encounter them. Support organizations and initiatives that are working to address healthcare disparities. Volunteer your time, donate to their causes, and amplify their voices. Advocate for policy changes that promote health equity. Contact your elected officials. Urge them to support legislation that expands access to affordable healthcare, addresses the social determinants of health, and holds healthcare institutions accountable for providing equitable care. We all have a role to play in dismantling healthcare apartheid. By working together, we can create a future where everyone, regardless of their race or ethnicity, has the opportunity to achieve optimal health and well-being. It is our mission at the Charlie E. and Minnie P. Hendricks Foundation to educate and advocate for those in underserved communities. We thank you for watching. Please like, share, and subscribe.